how much is your money worth if you can't even live the life that you dream of?
That's right.
Our goal is basically to trick the body into healing itself. So we're trying to inflame that tissue again. And the body responds by sending in a number of their own cells, kind of signaling it, hey, there's a problem here.
Hey team, Jim Cripps here with the Charge Forward podcast, and I have a special treat for you today. It is a collage of guests, some that you've already met before, and some that you haven't. And then, oddly enough, I didn't know that they knew each other. So we're going to just dive into this one, and we're going to have some fun. We're going to talk regenerative medicine. We're going to talk our men and women in our armed forces, and some of the special foundations and programs that help take care of them and help them enjoy a better quality of life. So without any further ado, Dr. Mike, welcome.
Thank you, Jim. Good to see you.
Bree, welcome.
Good to be here again.
Steve, welcome.
Thanks, Jim.
All right. So for anybody that doesn't know, so Dr. Mike, you've probably heard me talk about him before. So we met back in 2021, I believe. And Dr. Mike, right. You started as an ortho and then went neck deep into the regenerative medicine space.
Right. So I started in physical medicine rehabilitation, so basically non-operative orthopedics, doing a lot of interventional pain, nerve blocks, epidurals, facet joints, joint injections, you name it. And while I was helping people short-term and kind of get them out of pain, long-term I wasn't seeing the benefits or the changes that I was hoping for. So then I started looking for potential alternatives, and that's how I got kind of in the regenerative medicine space, starting with what's called prolotherapy, where basically we inject a substance, most of the time now dextrose, which is the sugar that's in all IV fluids, that can both be anti-inflammatory at low percentages, so we can use it for nerves and other things, but also can be inflammatory at higher percentages, where we can use it for joints, soft tissues, supportive structures, discs, cartilage, you name it.
And when we're using it as an inflammatory, what we're actually trying to do is we're trying to get the body to attack and try to repair that space.
Correct. So inflammation's thrown around a lot in the social media space, and not all inflammation is the same. So acute inflammation is actually quite helpful for us to heal, recover, get better, those type things. The chronic inflammation that's usually the problem, and that's what most people are speaking of. So the problem with what we do as far as treating most orthopedic issues is we shut down that acute inflammation. We use anti-inflammatories, we use steroids, we use other modalities, and it basically turns off the healing process. So with any type of regenerative therapy, our goal is basically to trick the body into healing itself. So we're trying to inflame that tissue again. And the body responds by sending in a number of their own cells, kind of signaling it, hey, there's a problem here. And we can get into some of the other therapies as well, including PRP or bone marrow or adipose. But basically that sends in cytokines, which are helpful for inflaming the tissue and or for healing, other growth factors, fibroblasts, which help kind of set down new tissue, and a good number of other things from that standpoint. And it also kind of works with the immune system as well. So we're kind of modulating the body's inflammatory and immune response to promote a healing phase and or a recovery phase.
Yeah. Well, and one of the things that frustrates me is a lot of this gets overlooked or it's kind of swept under the rug unless you're into the regenerative space. An example of that would be, just 2 months ago, I did a piece with Men's Health magazine. And what did they leave out of the fact that I went and got stem cell therapy in Honduras? They left you out completely. And then they also left out that it worked and that I'm healthier now because I got it done, which you would think would be something you would want in that article. But much like several of the treatments that you're talking about, because Big Pharma can't make huge amounts of money on them, they don't get talked about.
Unfortunate. But, I think, one of the bigger, complaints or criticisms is there's not a lot of literature. Well, that's not absolutely the case. And there are a great number of studies if you use Google Scholar or PubMed or those sort of things. And Chris Centeno, who is a physiatrist like myself, who has done tons of research and has kind of really moved this forward, usually each year, and he just put it out on, I think, LinkedIn, showing the number of studies just in the last year or two related to PRP, and they've outnumbered any number of orthopedic studies by multiples.
Yeah.
And there is good data there. Now, is it perfect? Unfortunately, no. But there's enough there showing positive response that you can quote and show that, hey, there are opportunities and options that may be as good as or even better than surgery. Now, are there certain things where surgery is absolutely necessary? Yes. And we still use orthopedic surgeons. They're not going to go away.
Sure.
And, you got a full thickness ACL tear, usually that needs to be fixed. Full thickness rotator cuff tear usually needs to be fixed. Broken bone that needs to be put back in place. I mean, certain things you're just going to have to fix.
Sure.
However, with that, doesn't necessarily preclude the fact that you could do regenerative therapies afterwards. I mean, they're going to hit the big things, but usually with an ACL injury, you've got significant bone edema, or think a bone bruise. Oftentimes, you're going to injure the medial collateral ligament, which is the one on the inside part of the knee. And oftentimes you will injure the medial meniscus too. So it's got a, not a great name. It's called the terrible triad. So, and it's degrees too. I mean, not all of them are horrible to the point where they need to be operated on.
Sure.
Some do. But a lot of times if you fix the ACL and you don't assess or treat the MCL or some of the issues with the medial meniscus, your outcome may not be quite as good. So there are ways to augment those treatments afterwards too. So it's not just one size fits all or fixes all either. Combination therapies, and some of the good orthopedic surgeons are actually doing that.
Yeah.
They're doing some regenerative therapies at the time of surgery, and some are even doing it post-surgery for the reasons that we just outlined.
Well, probably 3 years ago, right after I went to the biohacking conference, I think we had a similar conversation because of one of the conversations I had there. This gentleman had worked in the Florida State football program. He had worked with the Jaguars, and his point was, you may have a significant enough issue that you've got to have surgery, but by combining the therapies that are available with the surgery, you're probably going to heal faster and get more range of motion quicker and, more long term if you combine the two.
Right. I mean, a lot of orthopedic related issues are due to instability. So the goal is to try to re-establish that integrity of whatever you're treating, whether it's your knee, whether it's your hip, whether it's your shoulder, or any of the other things. So think of a tire that is on your car but not fully tight and it's kind of a little bit wobbly. If that's the case, your car is not going to drive great. It's not going to turn or corner well. You're not going to be able to get up to speed particularly well. And pretty soon you're going to shake it to the point where it may fall off, or you may have issues with your alignment or other things too. Correct. So if you can kind of reestablish integrity and kind of get everything more balanced, get everything tighter, and then work on some of the deficiencies from a muscle or nerve related standpoint where you've got either some tightnesses, you've got some weaknesses, you've got some instabilities, things aren't firing properly, you're going to have the best possible outcome that you can have. Perfect? No, but much better than you were previously. And again, I mean, I've lived this. I mean, I've had, issues in relation to my knee, my left foot and ankle, shoulders, that sort of thing, and definite benefits if get injected in the proper place. I mean, we can talk about all the nice tools and all the great things, but the other part is you got to put it where the problem is. So there's also the skill of using some type of imaging guidance, whether it be ultrasound, whether it be x-ray or fluoroscopy, in really trying to target the tissue that you're trying to treat. So that's the other piece that is incredibly important. So everybody asks, well, what do I have to use? It depends. But the bigger part is, I don't care what you use. If you target it appropriately, you're going to get a good response.
Right. Well, and I think most importantly is it's not one size fits all. And the thing I love about regenerative medicine, or people that are open to it, is it's not about one or two tools, or this is off the table and that's on the table. It's really, how do we use anything at our disposal in order to get the best possible outcome?
Correct. No question on that. And we'll talk about some other interventions that can be quite helpful and beneficial. But one of the things that I like better about what I do now than what I used to do then is I look at the whole person.
Yeah.
I don't look at you as, hey, you're a knee problem, or hey, you got a low back issue, or hey, you're just tired or fatigued. I'm kind of looking at you from head to toe and kind of getting an idea of more of the root cause of the things that are going on. So just looking at your knee, I'm looking upstream, look at your hip, looking at your low back, even looking at your upper body, see if there are particular issues or problems, along with downstream, looking at your foot or ankle. And kind of getting a full picture and piece of what may be going on, and then looking at your cell health and hormone health and some of the other things that are going to give you the best availability to heal, recover, and have the best functional restoration too. So and then looking at lifestyle pieces. Are you sleeping well? Are you exercising appropriately? Are you fueling yourself appropriately from a nutrition fluid standpoint? Are you doing some stress reduction type techniques? Are you unplugging a bit? Is your nervous system getting more balanced? So it can be overwhelming and daunting, but by the same token, I think if you're doing a good evaluation, both from a history physical standpoint and also doing appropriate assessments, either lab-wise or otherwise, I think your outcomes are going to be much better than if you're just treating just your knee.
Yeah. Well, and looking at that whole body experience, and what all triggers or what all pressures does the body have, kind of leads us to why Bree and Steve are here. I did not know that they knew you. They did not know that you knew me. And I was talking about you coming up for this episode, or this series of episodes, and Steve and I were talking, and Steve said, well, Dr. Mike's coming at the end of the month, right? And I was like, I don't know that we've talked about it. Have I already said that? And he was like, no, Bree told me. He's like, your doctor is our doctor. Had no idea. And then really didn't have any idea that you and Bree are working together on some stuff. So
we are.
Bree, what do y'all have cooking?
Yeah, so it was a surprise to me as well. Dr. Mike and I were talking, and we were just going over stuff because we've been partnering together. And he was like, hey, I'm coming up and I'm going to see Jim for the podcast. And I was like, how do you know Jim? But no, so we have been working together. So when Dr. Mike was talking about how he's addressing the whole person component, and how, it does take a lot of work, and it takes daily interaction, and something that I have noticed that is a gap in the health and wellness space is the doctors that are doing a good job, that care, that are trying to dig into a whole person concept. They only have so much time to be able to dedicate to every day with those people. And I have that time, and that's part of what my coaching is. And so we've been working together where if he's had someone who needs some help with some weight, or working on their lipids or their blood sugar regulation, stress management, exercise programming, all of that, where he gives their information, I talk to them, see if we're a good fit for each other, if we can help each other out. And then I've been working with them, and I've had quite a few clients that have come from Dr. Mike, which is also really great. Thank you.
My pleasure.
But I love data, and I've been using data to show the 3 month, six month progress of how these people are improving. And we address every component of their life. We address the digestion, we address blood sugar regulation, sleep, stress management, nutrient dense diet, and then I also add in the exercise movement component to it, because many people are not exercising in a way that builds skeletal muscle mass, and the programming that I do does that. And
nice.
When he was talking about alignment, and that happens often when someone's body isn't moving properly, whether they have a muscular imbalance, or they've been doing a movement pattern that doesn't benefit their body. They do that for a long period of time. They have weakness in some areas and strength in other areas. And so I've been working with them where we do a mobility assessment, It can be difficult when it's online because I'm not hands-on, but they videotape themselves working out. We do Zoom mobility assessments, and then we make sure that as we progress, we're addressing every aspect of their life, and we're working day to day, day in and day out with each other, and it's going really well. And I mean, that's how we know each other and have been working together, but I was definitely surprised too. I was like, how do you know Jim?
Well, it's a small world, and then at the same time, it's just, I think sometimes we gravitate towards people that are like-minded or that have good energy, and, I think we're all concerned with kind of not just our own health, but those around us, improving their health. With Libertas Cryo, Steve, you guys are crushing it in the cryo and alternative therapies. I love coming hanging out with you guys, and it's great to see the business growing.
Yeah, I'm super excited about the business growing, but also the things we offer, I think, are great options. I think they're really good in conjunction with other treatments. I think they can be really useful as in between waiting for different things. But I mean, one of the things that got me into this, regenerative. What we do is not nearly in depth or profound as what Dr. Mike does by any means. But whenever the Donovan and Banks Foundation sent me, not to Dr. Mike, I wish Dr. Mike had been with them at the time, but I went to Chicago and did the stellate ganglion block and some ketamine therapy. And, for me, the stellate ganglion block didn't really do a whole lot. The ketamine therapy was awesome, but it didn't last very long. So I found some alternatives that, again, not nearly as profound, but pretty decent to help me with what I had going on. And and then that aspect of looking for things to avoid surgery. Like, I wish instead of getting my shoulder surgery, I would have had a good regenerative medicine doctor to try some things out, because I didn't have to have that surgery at the time. Like, I was in pain, but I had been in pain for years.
Yeah.
And my surgery didn't go great, and I still have pain. And I only wonder, had I done something with a regenerative medicine doctor beforehand, could I have avoided surgery? Or if not avoided it, could I have had better outcomes afterwards?
Well, and I think that was one of our first conversations early on, is because since you started as an ortho, and I mean, good, bad, or ugly, if you go to see an orthopedic, a lot of times that's going to be a surgery. And you said, I got tired of cutting on people. And, you were like, there's a lot of things that we can do to avoid that, or there's a lot of things we can do in conjunction with that, or even before that, to make sure that the body is as healthy as possible to give it the best possible outcome.
Right. So just to be clear, I don't operate. So I do more of the non-operative therapies, but your point is well taken. I mean, if you're going to see a surgeon, the vast majority of times they're going to recommend that, and not out of malice or any of those sort of things. I think they're trying to help, truly.
With the tools that they have available.
Correct. But, I would say ballpark, and they've looked at this multiple times, probably 80 to 90% of things, and maybe even a little bit more that go to a, orthopedic surgery clinic are non-operative. But again, I mean, even Steve talking about the shoulder, I still think there may be possibilities of things that can be done now to even augment or accentuate his response and outcomes from that standpoint too. And then, Bree's been incredibly helpful. And, I would say two things, and she can comment probably a little bit more in detail on this, but I would say the vast majority of people from a nutrition standpoint think they do well. Almost nobody comes to me and says, I'm terrible. There's a few that are honest, but most people, I eat pretty clean. And to some degree that's true, but I would say on a whole, almost all of us either undereat or don't eat the right things, and we over-exercise. So we try to accommodate for that. I'm going to work out, do CrossFit 7 days a week. Well, that's not necessarily going to be good, because you're going to be inflamed.
That's right.
You're not going to recover. You're not going to grow. I mean, there's benefits to rest, big time. And I think those are things that people need to grasp to some degree. And then she does a great job with women and kind of working with, their cycles and some of the other things. And I'll let her comment a little bit more in detail on that. But, there's opportunities and ways to exercise during your cycle and or to try to enhance how you feel and, the way that your digestive system works and a number of other things too. So very integral. And, the other part is she gets a lot more touch points, which I think are very important as well. So trying to hit people and kind of keeping them engaged to some degree. Sometimes she probably is as much their therapist as she is their nutritionist and some of the other pieces, but that's
Sure.
also incredibly helpful and important to say, hey, you're doing good. Don't give up. Don't throw in the towel. I mean, if you're looking at weight, I don't say everybody, the vast majority, and unfortunately women probably a little bit more than men, want to look at the number on the scale. Mm-hmm. And it's a lot more nuanced and there's a lot more detail, which is why I think looking at in-body scanning or DEXA body composition scanning, looking at, recovery rates from either heart rate variability, sleep, some of the other things can be very important, because then you can look and say, your number didn't change, but you've gained 4 pounds muscle, you've lost 4 pounds of fat, and your bone health looks significantly better. Oh, how are your clothes fitting? Oh, much better. I'm down 2 sizes. Oh, okay.
Yeah.
Looks like we're moving in the right direction. How do you feel? Feel better.
That's right.
So, I think trying to give objective data is incredibly helpful, powerful, and important to try to give people a little bit more than just looking at the number and saying, eat less and exercise more, which isn't necessarily helpful for, I would say, the vast majority of folks. I think everybody's different.
Sure.
That's why, if you look at diets, not everybody does well with a carnivore or keto diet. Mm-hmm. There are some people that do better with a higher carbohydrate diet, believe it or not. Mm-hmm. And carbohydrates are not our enemy. They can be part of a good diet, especially, if you're looking to, recover well, if you're looking to grow. If you want to add some muscle or some mass, carbohydrates got to be a big part of that. Then the other thing is, if you don't have enough, you're going to turn your thyroid down to the point where you're going to have your metabolism reduced, which is going to also be problematic. So there's things all over the place, but again, we can balance those pieces out depending on what your goals are at that stage.
Yeah. Well, I think to use an analogy, it's kind of like cruise control. You can't set the cruise control and forget about it. There has to be some modification as you go along. And so what works today at, say, somebody that's 25 is not necessarily going to work when they're 35 or when they're 45 or when they're 55 or if there is an injury. I mean, I think even, what was it, about 2 years ago, you had a car accident, mm-hmm. and, it probably took you a year to really kind of get the mechanics back in line.
Yeah, I mean, it threw me for a loop for sure, both from a, nervous system standpoint and then, left foot and ankle. Mm-hmm. Initially left shoulder actually did well conservatively. Then my right shoulder started bothering me, and so I did have some adipose injections by one of my colleagues in December of last year, mm-hmm. and significant improvements. I'm 5 months out, give or take, now. And foot and ankle's probably 90 to 95% better. Shoulder's probably 80 to 85%. So significant improvements from that standpoint. And it was a big change from that standpoint, even though, I was still functional. I was still able to work. I was still able to do most of the things. But, even walking became a challenge and difficult. And, it definitely played on your mind for sure. So,
well, I think about it much like the car example you gave earlier is if you hadn't been focused on fixing the mechanics so that they actually lined up, and not that you couldn't walk, but you couldn't walk with the natural gait the way that you should. And so if you just let that go on, and this happens, to a lot of people, is they overcome or they allow their body to compensate as opposed to going and having it fixed, whatever that repair looks like. And then they wear out other parts, whether that's a hip or whether that's an ankle, whether that's putting undue pressure on their spine. There's all kinds of things. I think of Castle. He broke his toe the 4th day of school, and the fact that he was in a boot for 8 weeks, mm-hmm. with one side being higher than the other. Yep. It took months for the chiropractor to work with him and get that kind of dialed back in.
Yep.
Bree, tell me if I'm right or if I'm wrong here. So
I'd love to.
I know, right? Well, we've had some people come in and we've had some conversations specifically around like rehabilitation from a drug rehab standpoint. And for those that are doing great things in those spaces, it is very common that kind of the factor as to whether or not somebody stays on the right path or falls off the path is how long their engagement is with somebody kind of holding that accountability. Do you see the same thing in, because I will tell you, being the fat kid from the age of 3, I was addicted to sugar. And if I went and had something sweet right now, well, I'd be, right back at it. Do you see that in kind of your coaching and your discipline?
Yes. In the essence of everybody has patterns, and training yourself, training your body, training your mind to handle those new patterns, it takes time. And when you're able to do it and do it in a way where you're not feeling restrictive. So I deal a lot with food, of course, with people. And I have so many people, and like Dr. Mike said, every person that I have had has been under eating and over exercising, and convincing them to exercise less and eat more. And that is difficult, man. Because so many people will get stuck in thought patterns, behavior patterns, food patterns, cultural patterns that they think is appropriate. And that doesn't change overnight. Mm-hmm. And so those people also have issues with, they do carnivore as a crash diet. They'll do Whole30 as a crash diet. And they've done it for so many years that they get to the point of 2 to 3 weeks in, a month in of our program together, and we go slow. We purposely go slow and master one skill at a time. Mm-hmm. But even in that, they come to me and they're like, I don't know if this is working. I don't know if I'm doing this right. I might as well just quit and fail. They think they're failing themselves. They think that they've already failed themselves. So I don't deal in the world of addiction, but I would assume that with people as a whole, we get stuck on our patterns. And whether that is a self-destruct pattern, or you truly don't trust yourself that you can actually achieve this, you need help. And that's where a lot of people need that help in a month, 6 weeks. I actually have a client where we're 7 weeks in, and she has lost an inch on her neck and an inch on her waist and is down 5 pounds, and she was eating 1,000 calories, and now we're at to 1,700 calories, and she was working out 5 days a week of like a HIIT workout style thing. And she's working out 3 days a week, and we're doing floor mobility work. So huge change in her routine. And we were just talking the other day. She's like, I don't think this is working. I don't think I'm doing anything right. And I'm like, okay, let's go back to the data, which is why I'm going to start offering DEXA scans as a part of my program, because we are collecting data, but the scale is 1 point. And I like to do non-scale wins and remind people that the scale has a component to our health. It has a component to our fitness component, but it's not the only thing.
So for somebody out there, please explain a DEXA scan.
I think Dr. Mike might explain it better. So there's a couple different options. There's the
Correct.
body comp option, and you can go, so DEXA.com, you can go anywhere. It's in Tennessee, it's about $130. And they're looking at your lean muscle mass and your bones, your fat. I think you can explain it better.
Yeah, so it's a low radiation scan that does basically 2 things. So, and it runs concurrently. So it will look at your bone health, and then it will also look at your soft tissue components. So think muscle, think adipose, think connective tissue, and some of the other things from that standpoint, and can give you ideas about where you're starting. And we can also assess it moving forward to see if the changes that we're making, no matter what it may be, are moving the needle in a proper direction. So and everybody's like, I don't want radiation, I don't want this, I want that. It's like, how often do you get in a plane? And the radiation that you get in a plane on a daytime flight for an hour is more than what you would get with a DEXA scan, I promise.
Yeah, and you're talking about a grand total of maybe 10 minutes. Correct. And at least locally, in Pleasant View, they offer them for $75. So I would say a good range, and y'all keep me honest here, somewhere between probably 75 is on the low side and 150 on the high side. in less than a half hour's worth of time.
Correct. And then, you buy a package of, 2 to 4, then the price is going to be better. How often? I would say minimum every 6 months. I think that's a good way to do it. Some would say every 3, and I think it depends on, again, what your goals are. If you're a bodybuilder or you're looking to do a bikini competition, we may want to do it every 6 weeks. But if you're just looking more for general health, or you've got some osteopenia, some thinning of the bones, or you're in the osteoporosis range, then I definitely think it's worthwhile to kind of see where things are moving. And there's other things that we can check too, but it's another objective part. And there's other things that can be looked at that are a little bit higher level that are much more expensive too. So I don't think they're necessary. But this gives, in a short period of time, I think tons of information that you can use. The other thing I like it for, from a regenerative standpoint, is you're looking at size of all 4 limbs. So if you see a pound difference, say comparing your right leg to left leg or right arm to left arm, then that starts, my mind looking and going, okay, what's going on here? And oftentimes you'll pick up, I've had an issue with this left knee for years, or now I got a low back issue and sciatica, and it's affected my left side. So it's another part where also you can see changes and benefits of some of the treatments that you involve people in. And that could be as simple as getting them going into some physical therapy or personal training too. Yeah. So I think for what you get, I think it's got a great bang for the buck for sure.
What do you see as a good entry point for people? Obviously not everybody's going to be down in South Florida where you're at, but just regardless of where you're at, what do you see as a good entry point for somebody that maybe they've just been in Western medicine their entire life? They know nothing about peptides. They know nothing. They pretend to know things about diet and exercise. They're new to it all. What's a good starting point?
Yeah, I think looking for a good functional medicine provider, and or people that it's going to be a little bit foreign most that are most cash pay practices, because then you can tailor what you do to the client, not the other way around. If you're looking at allopathic medicine or insurance-based medicine, you've got to hustle, you've got to move quickly, otherwise it's going to be challenging for the provider, the office, the clinic, the healthcare system, any of that sort of thing to make enough money to kind of keep everything going. That's why the appointments are very short, 15 minutes, 30 minutes, probably max at this stage, whereas folks that run their own business or have a cash pay practice, they're able to, allow 60, 90, some even 120 minutes for an initial assessment. Now, you're going to pay for that time, but by the same token, you're going to get a lot deeper dive and look and really get ideas on potential root causes and things to really enhance your goals and kind of meet those type things. So, to me, blood is still the king.
There's so much you can derive from those.
Yeah, there's a century basically of studies on blood. Is it perfect? No. But it can give you a very good snapshot of where somebody is and where they're starting.
What are some panels? Because if I go see my doctor, and don't get me wrong, I have a great relationship with my Western medicine doctor in that when I tell her what panels I want to run, she starts writing. But for the most part, if you just go get a physical, they're running the bare minimum.
Correct. I think, and the other way to look at it too is looking at direct primary care too. So if you have interest in looking at a little bit different way to do primary care, that's a great way to do it. And most of those folks, again, are cash pay, and they have very small client lists. And they also will see you if you have a cold or if you got something else going on that may need to be assessed, which is the nice piece. I think the bare minimum still is fine. I don't have any issue with a CBC, complete blood count, a comprehensive metabolic panel, some of the baseline things, because you can garner still a lot of information from that. But, I think where we tend to dive deeper, at least I do, is, you're looking at more advanced inflammatory markers, looking at things like C-reactive protein, homocysteine, sometimes a sedimentation rate, which kind of gives you a little bit more of an idea, more of chronic inflammation. We're looking at all hormone markers, specifically a little bit or a lot bit deeper dive in thyroid, whereas most primary care panels are just going to look at TSH or thyroid stimulating hormone. Not a great way to look at thyroid. Looking at, your free T3, free T4, we're looking for autoimmune related challenges, issues with your thyroid, and picked up a good number of those and have had pretty good success with cleaning a lot of that up. Whereas people have been told, hey, there's no issue because your TSH is okay. Looking at your free and total testosterone, looking at your estradiol and estrogen levels, looking at for women, progesterone, even for guys. I mean, we make progesterone too, so if it's off, sleep can be poor. And kind of getting an idea on other facets of health, including, your pituitary health and some of the other things. If we're looking at our military members, I mean, cumulative brain trauma, unfortunately, is a real thing. Chronic brain trauma, or even, an acute brain injury too. So, oftentimes that can negatively affect your pituitary, and if we can help to enhance that neuroendocrine system, it can make a pretty profound difference. In fact, just this past weekend, I went to a course in Florida, and Dr. Mark Gordon was speaking, and he does a lot of work with military, ex-military folks too, and he basically, his practice is helping to enhance neuroendocrine function, primarily just looking at hormone-related health, and getting guys and girls back online and getting them going. So a lot of the things that I do with pretty much everybody I see.
Yeah. Well, one of the things that I love about the way you look at medicine is you don't see it as something you know everything about. You're constantly going to conferences, constantly going to new trainings on what's coming out, what's working somewhere else, and really kind of keeping an open mind to what that looks like. And I would just encourage other people, just in general, kind of staying in line with the car analogy, because when you say cash pay, 75% of the people watching are tuning it out. And yes, you have things that are under warranty on your car that they will fix, but you pay for maintenance along the way.
Correct.
And so for us to think that we shouldn't pay for maintenance, because when you talk about health insurance, people are like, well, if it's not covered under insurance, I'm not doing it. And I think that it's just a short-sighted way to think about things, because you're basically saying, until it breaks, I'm not going to do anything about it.
Correct. I mean, I have these conversations specifically just looking at imaging. So cash pay MRI is a real thing pretty much anywhere in the U.S. And it is not, in my opinion, and again, I'm not trying to spend anybody's money, but it's not expensive. I had a client recently in Orlando that was getting a shoulder MRI, and cost, including the reading, was just a little over $200. If you look at most other policies, almost every MRI has to get pre-certed or pre-certified, meaning that you're going to have to go through rigmarole and hoops. You're going to have to do 6 weeks of physical therapy and fail that. And you're going to have to do anti-inflammatories. We just talked about why that may not be the best idea or way to go.
Because it's impeding your body's ability to repair itself.
So they've created these artificial hoops for you to jump through just so you can get the scan done. And probably with your deductible and other things, you're going to pay as much, if not more. And then you're going to get a bill not just from the MRI company, but you're also going to get a radiology bill and some other things too. So, and again, you can look at both. I don't have any problem with, okay, if I do it insurance, what's it going to cost me? If I'm doing it cash, what's it going to cost me? And make an informed decision. And, I think those are the important pieces. I think the other thing, too, that people don't quite understand is when you submit anything to insurance is they now have leverage against you, meaning that if you put down a code just so you can get a lab done, they will use that code against you. For example, when this happened to me, I was trying to get health insurance, and one of the assessments and things we talk about on the lab panel is called DHEA or DHEAS, which is a hormone that's in the pathway going from cholesterol down to your sex hormones. To get that covered, you have to have a code for either adrenal suppression or adrenal dysfunction. The treatment is an over-the-counter supplement called DHEA.
And it's like $25 a quarter.
Yeah, it's nothing. So I tried to get insurance, and they saw that code, and they basically flagged me for it, and were going to raise rates, or they basically told me that they weren't going to insure me just for that. So while I understand people have it, they want to use it, they want to do all the things with it as best they can, and I totally understand. There are benefits to being a bit anonymous with those type things too, because it, helps you not just in the short term, but in the long term too. So, I think the take home is just look. I mean, don't just go, well, if it's not covered insurance, I ain't doing it. Well, it could be cheaper. I mean, even, I get folks too that, with their drugs. Oh, it's not covered. Okay, did you ask them what the cash pay price was? No. And oftentimes it's actually cheaper than what you would pay if it's covered. So,
well, and the other thing that I noticed too, and again, this is big pharma, is you'll have some medications that a 50 milligram dose is $30 a pill, and the 100 milligram is $6 a pill. And it just blows my mind. But I think people want the easy route. They want to show up at the doctor, and the doctor tell them what to do, or give them a pat on the butt and say that they're okay, and I'll see you again next year. And I think that's totally fine if you want to be the majority of people that spend the last 10 years of their lifespan without health span, meaning somebody's got to take care of them in some shape, form, or fashion, and they're not on their own. But if you want your health span and your lifespan to basically come as close together as possible, to be able to play with your grandkids, to be able to, enjoy life, you got to be more proactive.
Agreed. I mean, I think the other piece is too, some docs or people in healthcare don't like people that do research or read or, look at certain things and even question, right? Okay, why would you recommend that I do this?
Yeah.
Are there other things that I might be able to do? Or people that will come with some questions. And to me, that's showing me that you're engaged.
Yeah.
You are advocating for your health. Now, some of the things you may have written down may be, not true, or maybe a little bit out of whack or out of kilter.
Maybe even some bro science out there.
Which is okay too, but it stimulates conversation.
Sure.
And then we can do some education, some of the other things too. And there's been times where, I've learned something, or after we got done, I was like, okay, I got to research this a little bit, which helps me as well. I don't know it all.
Yeah.
Which is why I work with other people that have, knowledge in other areas where either I have some or I'm weak, but it's their area of expertise and they love doing it. That's part of why I do what I do, is I love to have collaborative partners kind of all over the country where I can just tap them and say, hey, help me here, or would you see this person, or do you know of anybody in, a state where they live that we could do as well? So I think those are all important pieces and keys, and, creating, relationships and, showing the client that you've got the best opportunity to help them, and it's not just all about you.
Yeah.
Well, and I think the big difference is I call it sick care. There's diagnosing and sick care, and then there is wellness and health span and lifespan, and you wanting those to match up. And so I think for a lot of people, when they're deciding whether to use health insurance or pay for the cash pay, it's deciding what kind of life you want to live. Do you want to live a life where you are struggling, waiting for a diagnosis, and then when you're diagnosed, oftentimes the damage is done? There's so many chronic conditions and diseases in our country that are 100% impacted by lifestyle. And so we'll use diabetes as a great example, just because I think it's over 50% of Americans are diabetic or pre-diabetic. And with that, that's lifestyle. You have power to change that. You are capable of it. It takes some change. That's hard. But you're capable of it. You're not powerless in that situation. And a lot of people will wait until they get the diagnosis and then they start doing it. But there's already potential damage that's happened in your body. So a lot of times when talking with people, I ask, do you want to wait to that point, or do you want to stop it now and help your body? Because your blood sugar regulation and insulin impacts every single area of your body.
Yeah.
And so it's not just oh, I have low blood sugar, oh, I'm a little dizzy, or I have high blood sugar, I feel a little weird. It's so much more. It's your entire body. And so when I think that the cash pay can be hard, it can be a hard pill to swallow sometimes. Sometimes it's cheaper, sometimes it's expensive, but like Stephen and I, we're both veterans. We have the VA, and because he retired, we have TRICARE, and they still don't fix what we've got going on. So we try to use the system, because every system is not perfect. We try to use the system to its best possible capacity, and then we just know that a part of our budget has to be spent on health and wellness, as opposed to just waiting for the VA to do what they're supposed to do. Because I've had so much help from Dr. Mike, and my VA doctors have all told me I need to stop getting the medicine that he's helped me with. I need to stop, and every time I'm like, I feel better. So I have Hashimoto's, and I had continuous growth of nodules on my thyroid, and my antibodies were not going down, and I had all these terrible symptoms. And I would go, and they would only do the TSH panel, even though I'd been diagnosed, so they wouldn't run antibodies. I would have to pay for that completely out of pocket, and I would be begging the doctor for help, and so that's its own problem. And they wouldn't run more, they wouldn't change my dose. I'd say, hey, this is not okay, my body's not okay. And it was one 30-minute call with Dr. Mike, and we got the medicine that I need. It's T3 and T4. And in the last year and a half, almost 2 years, my thyroid nodules have gone down. My antibodies are all going down. And I was doing the lifestyle changes. But sometimes, because I waited so long, I wasn't getting the help in that cash pay system. I had to wait till the diagnosis, until there was a big problem. And my body is slowly healing. But if I would have kept fighting that system, I would have kept getting sicker. And I think a lot of people, when they put it in that perspective, like, how much is your money worth if you can't even live the life that you dream of?
That's right.
So,
well, and the thing too is, I think a lot of times, especially when you get into standard Western medicine healthcare, it's almost this. They're almost the opposite of Dr. Mike. Dr. Mike, you're constantly learning, constantly trying to pair up with people that know more in a certain area than you do. And this is not a blanket. I'm not saying that everybody out there does this, but I'm saying a lot of times it is the assumption that your doctor knows everything, and whatever they tell you is exactly what you should do, and there's no other alternative out there. And then, to your point, there's a lot of situations where whether it's VA or somewhere else, the problem's not bad enough for them to be willing to fix it yet.
Or they can't. And so that's part of the hard conversation. It's kind of like there can be two truths in the same situation of not all doctors are bad. And even the ones that are stuck in that system, people don't go into medicine. They don't go and have all that crazy debt and all that education and all that sacrifice to screw people over.
That's right.
That's not a
Absolutely.
thing. They're stuck in that own, and they're adding value where they can. Like we have, I work with doctors. We have family members that are doctors, and they are in their area. They're doing the very best that they can. So it doesn't. I don't want it to be like I hate all of them. They're all failing, because they do a damn good job. And in the areas where they can, they do well. But there's so many limitations, and insurance is a big part of it, and big pharma is a big problem. But I don't want it to be like they're all terrible, because there's two truths. They can be doing their very best, and it's still not enough for health and wellness. Well,
I almost look at it like they're geo-fenced. Like there's a fence as to where they can go. They can be as good as they can possibly be, but if the thing that was needed was on the other side of that fence, they're not allowed to go there. And in a lot of cases.
In North Carolina, I was doing a lot of shadowing with PAs, and I was shadowing some functional medicine doctors and PAs. And then I also shadowed one where it was an urgent care clinic. They also did primary care, but he was doing his absolute best to do a functional medicine approach. And I don't know how that could be sustainable. Because he had so many regulations that he was stuck on, and running a clinic is very expensive. He had all these regulations he was stuck on. He was trying to help people, and there were plenty of times throughout the 3 days that I was with him that he was paying for something out of pocket himself to be able to give these people better care or a lab test that the insurance wouldn't approve, and it's not sustainable. So there definitely is a broken part of that system, but they really are like they're stuck.
Yeah.
They're kind of trapped.
Well, even I think with for all the faults that the VA has, there are some perks to VA healthcare in that. I think about my dad back in 2020. He was on Jardiance, and it has the potential to cause Forstner's gangrene. And so he goes on July 3rd, I think it was. So we're in the middle of the lockdown, and he goes, and the last thing my mom saw was him fall through the emergency room doors. Of course, she wasn't allowed in at that time because it was during the lockdown. And the surgeon called and said, good news is we have the team here, and we're going to give it a try. And I was like, give it a try? And he goes, roughly a 4% chance to make it through the surgery. Nowhere else would they have even tried. At VA, it's kind of like, okay, everybody's here. We'll give it a whirl. Whereas elsewhere, they'd have been like, yeah, insurance company's not going to cover that, so we'll make him comfortable till he passes. Knock on wood, he's still here today. So there are benefits. Absolutely, there are people doing great things out there, but it's up to us as individuals in order to decide what we are willing to spend of our time, of our money, of our brain power in order to increase our health span.
And quality of life.
Sure.
Yeah.
Some of it's as simple as taking a walk with the family,
Jim, you bring that up.
Yeah.
It's not just up to the individual to, really try to, we should all try to advocate for ourselves, but something I've learned with nonprofits and seeing different stuff and seeing how Dr. Mike helps people and Bree helps people, it's up to us to ask for help.
Absolutely.
And not just to your doctor, but to your friends, to the right people, or to anybody that if you need help, ask for help.
Yeah.
And don't be shy about that, because there are organizations out there are people that care, and if you ask enough, hopefully you don't have to ask much, but if you keep asking, hopefully you find those right people that can help you.
Yeah, absolutely. And really, that's how Dr. Mike and I met. Is I didn't know who to ask, and so I had dealt with my doctor and here in Nashville, and a good guy, but I knew based on my symptoms, I knew that my testosterone was through the floor, and I go in and I had them specifically run that, and I said it's either my testosterone or my thyroid. And I had lost 85 pounds at the time, and so I was like, I've done the hard work over here, but there's still something battling me, and I get not even a call back. I get my panel in the mail is circled, and it's in the red, but it says, "Don't worry, it's okay." And I'm like, well, what do you mean? It's in the red. So I call, and they're like, well. Yeah, but it's just in the red by a couple of numbers. Well, the red means I'm at the bottom. That's the bottom of the range. And so after some argument, in fact, he even said to me, well, I'm not here to help you get an extra pump in the gym. I'm like, you saw me when I was 305. I'm here at 220. What makes you think I'm trying to get a pump in the gym? I'm trying to live for my family. And just got incredible pushback. So, I go to the biohacking conference in order to figure out who do I talk to. And that's where Dr. Mike and I met. It's like, okay, well, and, I thought it was just incredibly profound that the first thing that Dr. Mike wanted to know was, what are your goals? What do you want to do? No doctor had ever asked me that. And so, yes, it's cash pay, but at the same time, you get a different level of service.
Now, I have a question, Dr. Mike.
Yeah.
When should somebody get their first panel or this stuff? So, looking at myself or a lot of veterans, especially special operators, they got this whole thing called operator syndrome, where a whole list of all these negative things are associated with that. And a lot of service members have low testosterone or all these other issues. But or Jim, like in your case, you're at the bottom, but like. Do you know what you were at when you were young and you felt good?
Have no idea, and that's a challenge because you don't know what your normal should be.
Yeah.
True. I mean, oftentimes none of those things are looked at in quote unquote healthy people. I would say ballpark, if it were a perfect world, I would probably get some type of a baseline or reasonable panel probably around the age of 20, to be honest. And then yearly after that, every other year, I think it's hard to say. I think it just depends on the same thing. I mean, what your goals are and kind of directions you want to go from that standpoint. And when you start throwing in exposures, whether it be heavy metals to a lot of the things you all have been exposed to, be it burn pits, be it bullets, be it explosives, all the other pieces, cumulative trauma, brain trauma, a lot of the things from that standpoint, I would probably say every 6 months to some degree in that ballpark. My folks, how often do we test? I would say initially probably every 3 months as we're starting to kind of move needles on things, and I want to see if we, again, are moving it where we want. I think once things are hopefully more in the optimal range and people are feeling better, I would say probably every 6 months. You could probably push it out to maybe yearly after that. But, I think that would be the minimum in my opinion. So, getting that first panel, I'll probably say early 20s would be the goal, but how realistic that is, I think is a bit challenging. But, I do think that would probably be worthwhile.
Yeah.
Well, and most guys in their early 20s, they feel great, so they're not thinking about it.
True.
And then when they start feeling bad, they're like, well, what am I aiming for? And trying to match up their symptoms and how they're feeling with their lab values.
Well, I know for me, early 20s, that ain't not necessarily, but I think it would have been great to have something like that before my first combat deployment. Before the first time I got blown up and were exposed to so many things. That'd be a great thing to have, and to include like some neurological testing and stuff like that. I'll never forget when I was getting out of the Army and they did some scans for TBIs and did stuff. They made me do all these tests, and especially special operations guys. They're pretty smart for the most part, and so you take these tests that are made for general people, and they're like, you're really smart. You passed those tests. You knew those big words, or you did all this stuff. I was like, yeah, but I felt slow. I felt like I wasn't there. Yeah, I got it. I'm smart, but I'm smarter than that still. And, there's just a lot of things that can be done preventative wise and baseline wise that I think can be important.
Well, I think it's twofold. I think if you were running in an ideal world, you would look at your special forces guys almost like your Ferrari race team, and so you would dial that in 100%. You'd have so much data it wouldn't even be funny. But this is the ugly side of it, and I'm not saying that this is true, but I think there's an argument for whether it could be or not. Is if they had that data, then they would probably have to take responsibility for what you lost.
100%. 100%.
So that could factor into why they don't collect that data. But obviously it's not right. I mean, let's just be real. I mean, selfishly, as an American, I would want our team to have the best of the best and as much data as possible, and to know like not just who's the sharpest, but who's by sharpest by the 1,000th degree. And then want you to stay that way, as much as possible. Which I do see, and I know that you guys have worked together, but, now there's some foundations and there's some work being done with special operators in the regenerative medicine space. And I could argue that, maybe that is the government figured out that it's cheaper to spend money on special operators in order to keep them longer. Or maybe they're doing it out of the kindness of their heart. We'll just let listeners kind of decide which side of that they think they're on. But that's really kind of how y'all met, and whether you were working together directly, but the foundation was similar or something of that nature, right?
Correct.
Yeah, and this is going to be moving the conversation in that way. I want to go back to that and what Steve said of reaching out and asking for help. We're going into the talk of veterans and how we met him, which is mental health component, and what Steve said is ask for help. That's a really big deal. So my best friend and I, we are both veterans, and we recently have implemented a new rule with each other of asking for 8 minutes. Mm-hmm. So a lot of people don't know how to ask for help. A lot of veterans and military don't know how to ask for help, but the studies and data have shown that 8 minutes with someone that you love and connect with helps regulate your brain and your emotional state. And so we've implemented that policy in our relationship of like, I would probably rather die than ask for help. And so knowing my own problem in that and not wanting to be a burden for other people, and I know a lot of veterans feel that way, implementing that 8 minute rule of like, you don't even have to ask for anything. You just say, hey, I just need 8 minutes. Mm-hmm. You don't have to go into detail. You don't have to be crazy about anything. You just need that time. Donovan and Banks was the nonprofit that Steve got introduced to, mm-hmm. and in North Carolina when he was getting out of the military, and they were working with other nonprofits that were being able to fund that and working with veterans for their overall health and wellness, pain management, which I think that goes along with stellate ganglia block.
Absolutely.
And then of course PTSD, anxiety, depression. And I think now, as we're talking and I'm reflecting, I was supposed to get stellate ganglia block in Chicago with mm-hmm. Steve, and I found out I was pregnant on that trip, mm-hmm. so I didn't get it. And then thinking at the time I thought, oh my God, 2 years, I'm still stuck in my own head and I can't get help. So it was very daunting and very scary to think I'm still trapped in my own head and I can't get the help that I think will make that difference. So that was very hard. Of course, hindsight is always fun. But in the perspective part of it, if I had gotten that treatment, I don't know if we would have ever met Dr. Mike. And so it's kind of that cool thing where you looked out years down the road and you're like, no, that actually worked out for a really good reason. Mm-hmm. But Stephen got stellate ganglia block. They had a ketamine therapy that he was able to try. And then I got stellate ganglia block in January of 24, and it has been life-changing. And that's how I met Dr. Mike, mm-hmm. and how the nonprofit that was paying for that. Like, there's so many nonprofits out there that if you are looking and asking for help, you'll find that answer. But they're there, and they paid for that for us, and it was truly life-changing and able to help us take our lives back.
Yeah. No, that's fantastic.
Yeah.
Dr. Mike, if you will share a little bit about, the foundation that you're working with these days and the work that you guys are doing down there.
Yeah, so dovetailing, taking just one step back, we're going to do another podcast tomorrow with a former Navy SEAL whom I've also treated. He'll go into detail. They have a really cool app called INVI, and that's short for Invisible Visible. So put together by two former Navy SEALs, and he'll go deep into the details on this, but they basically did it for support, similar to what Breanna was talking about. Mm-hmm. And they will tell you that they've lost more SEALs to suicide than they have to combat death. So what they did is they put together a program that was kind of like a buddy system. So they use wearable data, whether it be heart rate variability, heart rate, sleep, activity, and then you have to answer 5 questions each day. And they're very simple type things. And then they've got it set up if someone is starting to kind of fall off the wagon, that they have it's almost like AA, where they have a sponsor where that person will get in contact with that person to have a conversation, similar to what Breanna was touching on, and or they've got people on the ground that can be close to that person that they can intervene if need be. And some of it may just be a conversation. Some of it may be they need to get them help. Occasionally it may be they have to take them for, psychiatric intervention and some of the other things too.
Sure.
And, it's actually a very cool system. And then they're looking for ways to march that out to the general public too. So it's actually quite cool, and they can impart any part of data. Similar to what we talked about with the Dex body comp scan, they can use that data. They can use any type of lab data. They can use any piece that they can put in, and it's assessed by AI. So, and then they've also got a couple of nonprofits that we are going to tap into that also include first responders. That we're going to work with and come up with a pretty robust program in relation to treatment. So, lab pieces similar to what we touched on with Steve. Probably looking at comprehensive blood panel. We'll look at heavy metal toxicities, and we'll probably look at gut health as the top 3 things. And then definitely have the stellate ganglion block as part of the treatment, basically kind of getting them out of that fight or flight feel or that high stress feel. Think about looking at a squirrel looking around all the time. That's unfortunately where almost all of us live, or at least live there way too often. So what the injection does is just using an anesthetic agent to kind of break that cycle. And it's also got benefits both short and long term, but typically you will see significant improvements in heart rate variability. Typically a higher number is better. And also you'll see significant improvements in sleep scores and good other things too. So then it's also got benefits moving forward for reducing overall inflammation, cortisol levels, optimizing your immune system, kind of turning down hyperactive parts of your brain and turning up hypoactive parts of your brain. Works on the amygdala, which is kind of a part of our primitive brain where we hold a lot of our fears, a lot of our traumas, a lot of our injuries, and also turns down one of our stimulatory neurotransmitters called norepinephrine. And then it can help with gut. Where we do the injection is very close to the vagus nerve, believe it or not. So we can even hydrodissect that nerve at the same time if need be, if somebody has specific issues or problems. But it's almost like a reset in just kind of getting people back to balance. So you can get into that parasympathetic feel, that rest, relax, digest feel. Think about when you're sitting in a hot tub or in a hot bath, just zoning. That's kind of the thought that you want to have or that you feel. And it can work relatively quickly. Sometimes it can take a while. I mean, we've had people do day 1 and come back and go, I was in a car and got cut off. Usually I'd be yelling, screaming, cussing, bitching, moaning, complaining. It's like, didn't seem to bug me a great deal. And, a lot of times they'll go back and say, I took a nap for the first time in 10 years and it felt great. So it's almost kind of that unplug thing. Now, not everybody gets that. Some people, it will be stimulating, believe it or not, because that's kind of what they need. They usually kind of compare it to plant medicine and ayahuasca and some other things. People are like, well, what does it do? And my answer almost all the time is it gives you what you need. So, and for some people it will take a little time to kick in. Could be days, could be weeks, but as long as you're incorporating some of the other pieces too, I think it gives you the best opportunity for outcomes. But I mean, I've had some of the operators come up to me. Usually we'll have fundraisers twice a year, and a couple of them have told me, I had guns to my head, and I don't have that feeling anymore. I've had some wives come up and just give me a big hug and say, you saved our marriage, and get choked up a little bit. But
sure,
it's very rewarding, and it's been pretty amazing as far as some of the feedback we've gotten. And, it's, as I've told many people, it's given me as much as I've given them. So
absolutely. Yeah.
I'm glad you mentioned the wife-spouse component. And I definitely have my own experiences and stuff that brings my own problems to the table, which is always great. But the reason the foundation paid for me as a spouse is the service member, usually if it's the special operations, it's a guy, he will have PTSD, he'll have his own stuff. However that manifests, it's different for different people. But that is kind of communicable in a way where the wives experience that too. And I know far too many women where they are helping and supporting their husbands along the way, and that is still coming off on them. And so there are women that have gone and need that stellate ganglion block, not that specifically, but needing help with PTSD after spending a lifetime. 20 years is a lifetime. It's all of our young years in the military with their spouse deploying. And I mean, it's easy to be deployed. my friends and I like to talk about that. And there's hard things. There's hard things being deployed, but it's easy to be the person leaving. It's really hard to be the person staying and thinking I'll never see this person again.
Sure.
And Steve and I were both deployed, and on my deployment at the same time, and we were in the same country. And there was a 2-week period that I didn't know anything. I didn't know what was going on with him. I was part of the evacs. I was checking things every day. It was a very traumatic thing, and it happens. So like, that's a little bit more extreme I was a little bit more involved than most spouses are, but that women still experience that. And if just the guy gets the stellate ganglia block and just the guy gets his help, that's good for the family. It helps. But those women still need help. However that looks for them and their family, they still need help. And I think some women forget that if they weren't in combat or if they never deployed, they think, oh, it's not me. I don't need that. But often they do. And I think that can't be overlooked. It has to be talked about.
Absolutely. Well, you guys are a team, period. And so when one of you is suffering, the other one is too, just in their own way. And it's that fight or flight that's activated and just never gets turned off, which is not healthy. Again, I think it all goes back to, one, you have to be an active participant in your own health. You have to be willing to raise your hand and say, I need help, or you have to be willing to take the action to seek out a functional medicine doctor, or to get to ask for the additional blood panels, or to open up your wallet and go try cold therapy, cryotherapy, red light therapy, salt therapy, contrast therapy, shockwave. I mean, there's just so many things that are out there.
Or just carve out an hour a day just to go sit in the park.
Yeah.
Read a book.
Go for a walk.
Spend time with your kids. Just schedule it.
Yeah.
It's very impactful things that people can do that are free.
Correct.
And that, or you can do on your own, is mindfulness and breath work. Those can have 2 huge impacts
For sure.
on people's lives.
Yeah, absolutely. So I'm going to spring this one on y'all just a little bit, and anybody can answer. We can do it round robin, or we can do it however you want to. But I want to throw out some combination of like peptides, vitamins, therapies, mindfulness, etc. And just whoever wants to jump in, give it a score 1 to 10. Okay, I know this is going to be fun and a little bit disorganized, but I'm going to start with my favorite. And you can't hurt my feelings with these, whether I like them or not. I'm not saying that y'all have to. BPC 157, 1 to 10.
I'd probably say 9.
9. Okay. I'm dialing a little bit further into that one. The oral version.
I think if you've got GI or gut health issues, I think you're going to get a better response with that. I think if it's more of a musculoskeletal, inflammatory issue, brain trauma issue, kidney dysfunction issue, I would say more likely you're going to get a better response with the injectable.
Okay. TB 500?
Similar. I'd probably put in 8 or 9. Kind of same thing. Neither of them, I should say, one thing, I don't know that they found a lethal dose for either one.
Yeah.
Some people will get a little bit of a histamine reaction with BPC on occasion, where it can cause some increased release of histamine. I'd say that's rare, not unheard of. I had a few people who just unfortunately couldn't tolerate it. But yeah, I think quite safe and can be really good for, I think the 2 biggies are musculoskeletal pain and or inflammatory load. And then gut probably very close third as far as that goes, for sure. Okay. I think it's much better than, using, proton pump inhibitors like omeprazole and some of the other things which can negatively affect absorption of many nutrients, micronutrients that can cause some issues and problems.
Sure. Steve, I'm going to throw this one your way, and then we're going to have part B that's going to be breeze. Lifting heavy.
I mean, lifting is extremely important. I'd say lifting appropriate heavy, a 10.
Okay.
Almost anybody, if it's an appropriate weight, appropriate method. I mean, anything you can do to increase muscle mass is going to help your longevity, improve your use of glucose, and have so many profound effects on people that appropriately heavy is awesome.
Okay. Bree, lifting heavy for women.
10 out of 10.
Okay.
And I say that because, oh God, I hear it so much. The 1,200 calorie rule, which is the most dumbest thing I've ever heard. Please stop. Whoever's doing that, please stop. But so many women they look at the weights and they think, I'm afraid I'll get bulky. One, that is really, really hard to get there. Two, the women that truly are bulky, when you look at them, they're usually bodybuilders or some type of competitor in that way. And usually they're doing some type of performance enhancement. So it's, if women want that sexy shape, those curves, the big, beautiful butt, you need to eat food and you need to lift heavy appropriately.
Yeah.
And I promise you won't get bulky.
Yeah, getting bulky is so hard.
It's so hard.
And especially if you're over 25.
It's
like if you're
so
over
hard.
25, good luck getting bulky.
Yes, I have been trying to get bulky strong for a couple years and I'm not there, and I have been trying. So it's not going to happen. What's going to happen is they're going to feel and look sexier. And so many women are like, I think I'll look like a man. Like, no. That beautiful shape that you see with women where they have more of an hourglass and shape in their shoulders and a big, beautiful butt, that's muscle. It's that comes from lifting heavy.
And it's on purpose.
On purpose.
Yeah.
10 out of 10.
I love it. Well, team, thank you so much for all of you joining us in the studio today. And I think it's just serendipitous that you all knew each other. Dr. Mike and I had met. And then when you got the therapy last January, it wasn't long after that when we met for the first time. So anyway, the world just works the way it's supposed to. I love it.
That's a great way to put it.
That's right. That's right. Well, team, thanks so much for joining us here on the Charge Forward podcast. Again, the goal is to bring amazing guests that come and share bits and pieces of their world, their experiences, the things that they do to help others, and so that you can take some building blocks from that and make your world even better, or maybe help somebody else that you know. Again, please continue to share the podcast and let us know who you enjoyed the most, what your favorite parts were, and we will continue to bring amazing guests each and every week. Remember, episodes drop every Thursday, and again, we come to you live from Hit Lab Studios here in Nashville, Tennessee. Thanks so much. Take care. Team, is Jim Cripps here with the Charge Forward podcast. I just want to tell you, I love you. I appreciate you listening. I appreciate you for subscribing and sharing the Charge Forward podcast with people you know and you love, because that's what we're here for. We are here to share the amazing stories, the things that people have been through, the ways that they were able to improve their life, so that you can take little nuggets from theirs and help improve your story and be better tomorrow than you were today. I hope that this is the tool you needed at the right time, and that you find value in the amazing guests that we bring each and every week. Thanks so much, and don't forget, new episodes drop every Thursday.